Nose. The nose is more than just a feature of the face. It's the starting point of your respiratory system and the organ of smell. In this video, we'll take a detailed look at the anatomy of the nose, its parts, functions, and clinical relevance. Let's get started. The nose is the uppermost part of the respiratory tract and contains the peripheral organ of smell. It consists of the external nose and the nasal cavity. The Greek word for nose is rhinos. Thus, the study of the nose and its diseases is termed rhinology. The functions of the nose are 1. Respiration. 2. Olfaction. 3. Protection of the lower respiratory passages. 4. Air conditioning of the inspired air. 5. Vocal resonance. 6. Nasal reflex functions. External nose. Features. The external nose is a pyramidal projection in the mid-face. It presents the following features. 1. Tip or apex, the lower free end. 2. Root or bridge, the upper narrow part, which is continuous with the forehead. 3. Dorsum is a round border between tip and root where sides of the nose meet. 4. Nostrils or nares, the two piriform apertures at the broad lower end. 5. Ala is the lower flared part on the side of nose. Skin, the skin covering the nose. Nasal skin is thin and loosely attached to the underlying structures, hence freely mobile. Over the apex and alae, it is thicker and more adherent and contains large sebaceous glands, whose orifices are usually very distinct. Skeleton, the skeletal framework of the external nose, is partly bony and partly cartilaginous. The upper 1/3 of the external nose is bony, and lower 2/3 is cartilaginous. The bony framework is formed by 2 nasal bones forming the bridge of the nose and frontal processes of the maxillae. The 2 nasal bones meet in the midline and rest on the upper part of the nasal process of the frontal bone. They are held together between the frontal processes of the maxillae. The bony part of external nose terminates in front and below as the piriform aperture. Cartilaginous framework of the nose is formed by 5 main cartilages and several additional tiny ones. The 5 main cartilages of the nose are as follows. 1. 2 lateral cartilages. 2. A single median septal cartilage. 3. 2 major alar cartilages. The lateral and major alar cartilages are also termed superior and inferior lateral cartilages, respectively. The cartilaginous framework is anchored to the piriform aperture by fibrous tissue. Medially, it is continuous by a narrow bridge with the septal cartilage. The major alar cartilage is U-shaped and comprises of a medial and lateral crura. The medial crura of 2 sides meet in the midline below the lower margin of the septal cartilage to form the lower part of the nasal septum called columella. The lateral crus of major alar cartilage extend into the ala of the nose, but does not reach the bony margin. The gap is filled by fibrofatty tissue and minor alar cartilages. Nasal cavity. The interior of the nose is divided into right and left nasal cavities by a nasal septum. Each nasal cavity communicates with the exterior through nostril or nares, and with the nasopharynx through the posterior nasal aperture. Each nasal cavity is divided into two portions: a small antero-inferior part lined by skin, the vestibule, and a large postero-superior part lined by mucosa, the nasal cavity proper. Vestibule of nose. It is the antero-inferior part of nasal cavity lined by skin. The skin contains sebaceous glands, hair follicles, and the stiff interlacing hair called fibrossae. Its upper limit on the lateral wall of nasal cavity is marked by limon nasae. Its medial wall is formed by a mobile columella. Nasal cavity proper. Boundaries. The nasal cavity proper presents the following boundaries: 1. Roof. 2nd floor. 3rd, medial wall, septum. 4th, lateral wall. Roof. The roof is very narrow in front and widens to about 1 centimeter near the choanae. It is horizontal in the middle third, where it is formed by the cribriform plate of the ethmoid. Through this olfactory nerve entered a cranial cavity from the nasal cavity. Floor. The floor is almost horizontal. It is formed by the upper surface of the hard palate. Anterior 3/4 is formed by palatine process of maxilla, and posterior 1/4 is formed by the horizontal plate of the palatine bone. Medial wall. It is formed by nasal septum. The nasal septum is a median osseo-cartilaginous partition between the two nasal cavities. It is seldom exactly in the median plane, but bulges to one or the other side, more frequently to the right. The bony part is formed by perpendicular plate of ethmoid, which forms the postero-superior part of the septum, and vomer, which forms the postero-inferior part of the septum. The cartilaginous part is formed by septal cartilage, which forms the major anterior part of the septum and fits in the angle between the vomer and perpendicular plate of ethmoid, and septal processes of the two major alar cartilages. Clinical aspect. Deviated nasal septum, DNS. The deviated nasal septum is not uncommon and is an important cause of nasal obstruction. The males are affected more than females. It occurs due to numerous factors such as trauma, developmental error, etc. If DNS is severe and causing mechanical obstruction, leading to difficulty in breathing, sinusitis, headache, excessive snoring, etc., it is corrected by submucous resection, SMR, or septoplasty. Lateral wall. The lateral wall of the nose is complicated. It is formed by a number of bones and cartilages. The bones forming the lateral wall are nasal, frontal process of maxilla, lacrimal, conchae, and labyrinth of ethmoid, inferior nasal concha, perpendicular plate of palatine, and medial pterygoid plate of sphenoid. The cartilages forming the lateral wall are a lateral nasal cartilage, upper nasal cartilage, major alar cartilage, lower nasal cartilage, and 3 to 4 tiny cartilages of the alae, minor alar cartilages. Features. The lateral wall is divided into the following 3 areas. Anterior part presents a small depressed area, the vestibule. It is lined by the skin containing fibraceae, short, stiff curved hair. Middle part is known as atrium of the middle meatus. It is limited above by a faint ridge of mucous membrane, the agar nasi. The curved mucocutaneous junction between the atrium and vestibule is known as lemon nasi. The posterior part presents 3 scroll-like projections, the conchae or turbinate. The spaces separating the conchae are called meatuses. The conchae and meatuses form the main features of the lateral wall. Conchae, also called turbinate, are the curved bony projections directed downwards and medially. Below and lateral to each concha is a corresponding meatus. From above downwards, the conchae are superior, middle, and inferior nasal conchae. Sometimes a 4th concha, the concha suprema, is also present, Conchae. Superior and middle nasal conchae are the projections from the medial surface of the ethmoidal labyrinth. Second inferior concha is an independent bone. The superior concha is smallest, and inferior concha is largest in size. Meatuses are the passages beneath the overhanging conchae. They are visualized once conchae are removed. Inferior meatus is the largest and lies underneath the inferior nasal concha. Middle meatus lies underneath the middle concha. It presents following features. Ethmoidal bulla, bulla ethmoidalis. A round elevation produced by the underlying middle ethmoidal sinuses. Hiatus semilunaris, a deep semicircular sulcus below the bulla ethmoidalis. Infundibulum, a short passage at the anterior end of middle meatus. Superior meatus is the smallest and lies below the superior concha. A triangular depression above and behind the superior concha is known as the sphenoethmoidal recess. Lining of nasal cavity. The lining of the various regions of nasal cavity are as follows. Vestibule. It is lined by the skin containing a large number of sebaceous glands and interlacing coarse hair, the vibrissae. Olfactory region. The upper third of the nasal cavity bounded above by cribriform plate of ethmoid, laterally by superior nasal concha, and medially by upper 1/3 of the nasal septum forms the olfactory region. It is lined by the olfactory epithelium, which contains receptor cells for smell. Here, mucous membrane is paler in color. Respiratory region. The rest of the nasal cavity, lower 2/3, is lined by the respiratory epithelium. Pseudostratified ciliated columnar epithelium with goblet cells. The respiratory mucosa is highly vascular and contains a large number of cavernous spaces and sinusoids to warm the air. In addition, it contains a large number of serous and mucous glands. The secretion of the serous glands makes the air moist, while the secretion of the mucous glands traps the dust and other particles. Openings. The lateral wall of the nose has number of openings. From sphenoethmoidal recess, opening of the sphenoidal air sinus takes place. From superior meatus, opening of the posterior ethmoidal air sinuses. That was a detailed look at the structure and functions of the nose. from the external features to the complex internal anatomy. If you found this video helpful, don't forget to like, subscribe, and share. Thank you for watching, and see you in the next one.